everyone. So this is part one of the two videos I'm going to upload to YouTube. This is the introduction of my paper, and then the second one is an actual video that I took of music therapy in action. So this is part one. I decided to do my paper and my final on music therapy because for one, I love music and it makes me feel good, and I was really interested in how it's used in the clinical setting in terms of therapy, its applications and so forth. So just a little background on music therapy. It's well, first I guess you have to know the history of it. Music has been used for hundreds of years for celebrations, religious celebrations, worship, devil worshiping, what else? What are those things called? Demonizations, you know, when you exorcisms, that's what I was thinking of, and so forth. So, you know, when you think of music therapy, it's important to realize that it's not something new. It's probably one of the oldest interventions out there. But as a clinical intervention, we started seeing it come about with the wars during probably the 1930s, when a lot of the American military members were coming back wounded and they were convalescing. Music was initially brought into the wards as a form of treatment, and it was found that the music, the effect that it had on these wounded service members, was that it was calming, it promoted self-esteem, it helped with pain management, and it helped them with coping skills. So, and control, self-control. So it was really, when that started happening, that's when music therapy started to really be recognized as a clinical therapeutic intervention. And it was shortly thereafter that schools began to recognize it as a curriculum and began to offer it. But music therapy is a form of musical intervention in a therapeutic setting with the goal of aiding a person in a psychological, physiological, and emotional manner. And one of the things that kind of piqued my interest with music therapy was the effect that it had on Congresswoman Gabby Giffords. If you recall, she took a bullet to the left hemisphere of her brain, which is the section of the brain associated with language and speech, and it actually left her unable to speak. She worked extensively with a music therapist, and through her efforts she was able to reteach herself speech and language by utilizing pathways on her right hemisphere, which is not generally associated with language. So you can see it has a very huge clinical aspect to it. So that was something that piqued my interest, and I thought, well, let me learn and see what type of emotional aspect it can have. If you go and watch videos of Gabby Giffords, you'll see that she couldn't speak, but she could sing her words. And she created new pathways in her brain associated with speech, on the hemisphere that's not associated with speech. So music is one of those interventions that actually engages all of your senses. So I thought that was kind of amazing too. There are different types of music therapy. Well, there's two types primarily. There's active music therapy and there's passive music therapy. Active therapy is when you have an intervention. It could be a one-on-one or a group, and you're inhibiting, or your therapeutic subject or subjects are actually contributing to it through using instruments, through singing, through songwriting, through lyrics, through improvisation. What the therapist will do is guide them. They might use some guided imagery for relaxation, depending on what the goal of therapy is. And then passive music therapy is when the patient is at rest and the music is played to them and the goal is calming. to calm the patient. So that could be used for maybe some anxiety. Music, along with guided imagery, is kind of a big theme in this particular intervention. So they use a lot of that. Some of the applications of music therapy can be used for illnesses. You see it used a lot for cancer patients, for pain management, for addictions. I found this kind of cool. With addictions, music therapy is used as a means of teaching them self-control and coping skills, some motivation, and so forth. Traumatic brain injury it's used for, because again it helps, it's used in a more neurological manner. It's used a lot with anxiety and depression, because it allows, again, the patient to engage some areas of their brains that are associated with serotonin and so forth. It's also used with PTSD, and I found this kind of interesting because we're seeing so many cases of PTSD. It's been effective because sufferers of PTSD, they're able to be in a safe environment where they can express themselves, and some of the methods that are used for PTSD is just simply having them in a group and having them beat on a drum, and they can start like with simple soft beating to really expressive, almost angry beating, and it allows them to release, and after they're able to release in this safe environment, then they can discuss how they felt, and it allows them to be in an environment where they're all going through the same thing, and it's a coping strategy. So I thought that was really cool too. So that's basically a little bit of background on music therapy. The part 2, you're going to see Dullen. She is actually a board-certified music therapist, and she is interacting with a group of adults who live in a adult home, and most of them suffer from dementia. I've had to blur out some of the other people because I didn't get consent from them, but you'll see Irene is the subject that I did get consent from, and Irene suffers from dementia, but she doesn't suffer as bad as some of her housemates, so she's actually a really good subject. But what the goal in this particular group intervention, according to Dullen, the music therapist, was that because they are suffering from dementia, they lose touch with reality. So her goal is socialization. She wants to get them to interact with one another. But you'll see she uses instruments as well as songs to ground them back into reality. In this particular intervention, she's talking about ways of transportation. So she'll ask them, do you remember what a Buick was? Do you know what an old gray mare is? And you'll see how it just kind of sparks in them when they go, oh yeah, I remember what an old gray mare was. I had one of those when I was little. So it was really, really fascinating to watch. And it was fascinating to see how they responded in such a positive way. So I hope you enjoy the short video on music intervention. Thanks a lot. Bye.